Hi, my name is Lauren Bresnahan, and I'm going to be demonstrating on how you would suction a trach patient. So suctioning is typically used for patients that have like a new trach, or they are like in with pneumonia and they have a lot of secretions that they can't manage. And I have seen in the hospital where some trach patients can suction themselves, and they prefer it that way because it's not very comfortable if other people do it, and it's a very uncomfortable procedure in general. It causes them to cough and gag, and especially if they're pretty new with a trach, then they are not a big fan of the procedure. And they usually, I think they do it about every 12 hours, or basically whenever the patient feels they need, or if they hear a patient's lungs and it sounds super crackly and they can just hear a lot of secretions kind of building up in the airway and the lungs, they like to kind of suction that to manage the secretions and have a good airway. So what you would grab is a 14 French suction catheter kit, and this is a sterile technique. And so first, you'd want to get the patient prepped and get their vital signs. So you'd want to get lung sounds, especially to hear if there's any crackling, and then because you wouldn't want to suction them if it doesn't sound like they really need it, or if it shows that they don't need it, because it's not a procedure that you just do for the heck of it. And then you would do lung sounds. You would check their O2 stat, see what their oxygen is at, and making sure they have a good airflow. And then you would assess if they have any nasal cannula or any kind of, well, obviously they don't need nasal cannula, but if they have something over their trach for oxygen. And then you would assess vital signs in general, so just your normal vital signs, pulse, blood pressure, all that fun stuff, just to kind of see what their vitals are going to be before, and see if your procedure was effective. And so if they do have some type of mask or something covering their trach to help them get air, then that is something you would take off during the procedure and then would reapply during suctioning, because they would want to make sure they're getting enough air in between so they're not completely depleted. And you want to kind of assess their O2 stat while you're doing the procedure to make sure you're not taking all their oxygen away. And you would also make sure they cough and deep breathe and are sitting at 90 degrees so they have a really good airflow, and they're just trying to get all those secretions kind of from their lungs into the airway, so we can kind of get those all up. And so first thing you would do is you would grab your kit, and then you would open it, and you don't need gloves at the moment. And then you kind of want to get stuff prepped before you kind of get your sterile gloves and stuff on, because it's a sterile procedure. And so first, you would get your little box that you have that you put your saline solution in. And the saline solution is kind of just a test to see if the suction's working for the suctioning chamber. And then you'd want to turn on the suctioning, and you'd want to do it on the lower end, because if you do it at a higher end, it can be a little bit more damaging to the tissues. So low and medium, you would turn that on. Make sure everything is hooked up correctly, and don't touch anything that needs to be sterile. And then you would get everything prepped. And then next I would get my sterile gloves on, because I have everything ready. So I have my saline in my saline box, and then I have everything hooked up and my suction turned on. And then next I would get my sterile gloves on. So I would open my package. We're gonna pretend that didn't happen, and that did not just fall off. It didn't fall off. So we're gonna open this. Everything's extremely sterile. Open this, and then the gloves are kind of in there, kind of messy, so it is a challenge. So first you're gonna grab the cuff, and then I'm gonna put my dominant hand in first, which is my right hand. And then next I'm going to put my left hand in, so I'm going to grab it with my 2 fingers and make sure I keep my thumb away. Slide my hand in. So now I'm sterile. So for this procedure, you are going to have one hand that will not remain sterile the whole time, but you still want to keep the sterile glove on. And so next I'm going to grab this, which will be the tube that is inserted into the trach, the stoma. And so you kind of just want to get this part up, and you can touch it with your sterile hands. And so then this hand will no longer be sterile, and you will grab the thicker suctioning tube that's hooked up to the suctioning chamber, and you would attach that. So this is now attached. And so then you would get the package out. So I'm just gonna pretend that this is attached. So this is what it's gonna attach into. So this is all attached. So now this is still my sterile hand, and I can grab this. And so then I'm going to dip this into the saline solution. And then I'm going to hold my thumb over this hole, which is going to initiate the suctioning, just to make sure the suctioning is on and working properly. And so after I know that is working and I have some saline sucked up in here, then I know that is working properly. Next, I want to step on the side of the patient and kind of walk them through everything that's going to happen and what is going on, just to kind of be, so they're aware of what's happening, because it is very uncomfortable prior to what I said, and it can cause them to cough, and you don't really want to be standing in front of them and get splattered with mucus. It's not fun. I've been there. Anyways, so you want to keep your thumb off the hole. You don't want to touch this quite yet, because that's going to initiate the sucking. So you don't want to suction while you're going down. You want to suction as you're coming up in a twisting motion. So you're going to stick it in as far as you feel. They are going to cough, especially if they're new, and that's just going to happen. So like I said, you want to kind of keep your distance. And so you would stick this down the trach, and then as you are leaving, you want to hold on. You want to press on this and kind of intermittently suction. You don't want to just suction the whole time and really cause them to lose air. So you kind of want to just intermittently suction as you're twisting out. And then you would keep doing this until the patient, and you would dip this back in. I lied. You wouldn't do that. So you would keep doing this until the patient feels that they don't need to be suctioned. They'll usually tell you if they want it, and some people just want it once and done because it's not very comfortable. So when you're done, you would unhook this. So this is dirty. This is gonna be dirty now. And if they had oxygen on, then you would want to reapply that in between each suction to make sure they're getting an adequate amount of air, and keep making sure they cough and deep breathe just to keep that air going. And so I pinch and I pull this glove off, and then I drop it in this hand, and then I would put my fingers in and then get rid of this, and then I would toss this away. And then you are done, and then you would want to reassess vitals after, just to make sure that what you did was effective and they got a lot of the mucus up and the lung sounds are clear. And then you would want to document everything that happened. You want to document the color of the soma, how well they tolerated, and the amount of mucus. Usually you don't empty the chamber. I think you just mark it, just to kind of, after you're done, just mark it. And then you would want to document the color and how well they tolerated, and that is it. So just make sure you document everything and make sure they have enough oxygen, reapply oxygen, have them cough and deep breathe, talk them through the procedure, and then I'm gonna do another video for cleaning so I can kind of get stuff, but usually you'd want to suction and then clean them. But yeah, I'm gonna do that separate video so the video's not too long.